Thank you all for being here, and I would like to introduce Sharon Johnson with Susan G. Komen. And we're here to, again, talk about our annual event that we have at Fresno State every year. Susan G. Komen, Race for the Cure. This year will be the 17th anniversary of that event to raise funds for breast cancer awareness. There's been a lot of developments, a lot of things happening, and not only do we want to talk about the race today, but we also want to talk about some things that have happened recently in the news, including some of our efforts to get low-cost or no-cost mammograms out into our communities at large to women who may not have the access to health care that many of us do. But for right now, I would like for Sharon Johnson to say a few words.
Thank you, Sheriff Mims. It's been the goal of Susan G. Komen Central Valley and Sheriff Mims to provide a way that women have access to education, screening, and treatment, particularly an event that provides access for clinical breast exams and mammograms in the same day. We were able to accomplish this on September the 26th. Sheriff had always been at the forefront of this project. It took us a while to develop it and to maintain success, but we were able to perform clinical breast exams and mammograms on 12 women, 3 of which came back as abnormal mammograms. So they are being sent off for treatment. In order to do this, in order to provide these screening events, it's so important that the community support this project. And the way they can do this is at the Komen Central Valley Race for the Cure that is Saturday, October 24th at Fresno State. If they can't participate, they can donate on our website at KomenCentralValley.org. We have had some interesting developments today in a release from the American Cancer Society on screening guidelines. This is a perfect opportunity at the race to present the 4 steps to breast self-awareness to the community, because so much of these medical decisions are based on risk factors. And our number one breast self-awareness is know your risk. The second is get screened. The third is know what's normal for you and to make healthy lifestyle choices. We do hope that people join us. We're able to fund these projects through the city of Fresno and also in rural Fresno, where access to these life-saving services are very low. Sheriff, did you?
Sure. I feel very fortunate. I have good health care coverage. I also kept my mammogram appointment, and that was how my breast cancer was discovered. Many women in low-income Fresno County or rural Fresno County don't have health insurance. They may not have the access to health care that I was fortunate enough to have. And years ago, when I saw the statistic that more women of color died as a result of breast cancer than women of other cultures, I was very concerned, and that's when I approached Sharon and I said, we need to do something about this. And Sharon figured out what to do about it. So at that event at Gaston Elementary School earlier this month was a very moving event, and I think the results speak for themselves. 3 out of 12 women had some kind of finding. Those 12 women may not have had those checkups. Those 3 women may have developed a malignant breast cancer. So I feel very fortunate to have a partner like Susan G. Komen and Sharon Johnson to get the news out there, because Fresno County can do better than that. Fresno County can do better than 41% of our women of color passing away as a result of a breast cancer diagnosis more than other cultures. And we're going to do better than that together. And we will do better with the support and the help of the public out there who support the event, the Race for the Cure, that will occur Saturday. Are there any questions?
Sure. A question about September 26th.
Yes.
Explaining a little bit what exactly happened at Gaston that day, that from the support of the race here at Fresno State, what happened that day that you were able to support those women?
Well, funds from the Komen Central Valley Race for the Cure actually helped us pay for the facility, helped us pay for supplies, helped us pay for the planning of this event. But the event was very simple, really. We also incorporated a health fair environment. Other organizations were there to educate on health concerns for women of color, but this held women of color as a captive audience. They came in, they went through our health fair, they had a clinical breast exam, and instead of leaving and not returning for a mammogram, all they had to do was walk across the hall. We know that's a successful way to screen women. We know that's what our future brings. For those women that don't have transportation, it is essential that we have these programs where they can have it right here in this room and walk across the hall and have their mammograms.
Part of the importance of this event also is education. You know, as the standards change all through the years, I don't want women to become confused about what they should do, what they shouldn't do. And so a lot of the funds that are raised are for public and education about breast cancer and keeping women advised of what they should be doing and when. And so that's the beauty of this event. We really need to avoid women out there becoming confused about changing recommendations. Any other questions? All right, thank you very much.
Thank you.